Gleneagles presents Hospital Admissions and Discharge. Ken is scheduled to go for surgery. On admission day, he takes a queue number and is soon called to Admission Officer Lucy's counter. Lucy explains that there are only 4 simple steps for his admission. First, Ken needs to pass Lucy his original identity card and doctor's documents. Next, Lucy will give Ken an agreement for hospital services to sign. This is an estimated cost of his hospital stay, excluding the doctor's fee. 2 estimates will be given, based on the statistical records of hospital bills from previous admissions. The 50th percentile estimate shows the amount where half of all patients would eventually pay more, and half of patients would pay less. However, the 80th percentile estimate shows the amount that just 1 in 5 patients would end up paying more. Ken can use it as a guide to gauge how much he needs to pay when his bill arrives during discharge. Ken isn't too sure about that. He has insurance, so surely he doesn't have to worry about paying these bills. Lucy tells him that's not true. While his insurance might cover all his costs, Ken still has to pay all his bills during discharge. Ken is surprised. Not to worry though. Lucy says the hospital will make a claim on his behalf, and Ken can get his money back when the insurance company reimburses the hospital in about 4 to 6 weeks. Lucy then presents Ken with his payment options: self-paying, Medisave, other health insurance or company insurance, or local health shield. Each of these has different processes. Choosing Medisave will require him to fill up the Medisave authorization form. However, if he chooses to use other options, he has to fill up the non-utilization form. If Ken wants to use a company or other health insurance, he will need to provide a letter of guarantee during admission. Otherwise, he needs to pay a full deposit during admission. Ken decides to use his local health shield, and he fills up the claim form for Medisave approved integrated plan. Ken also pays the deposit and is almost done. Lastly, Ken will be assigned his hospital room. Lucy explains that his room availability changes based on ongoing discharges and sudden emergency patients. She can only find out if his preferred room type is available at the time of admission. If his choice is not available, Ken will be provided an alternative and transferred to his ideal room when possible. After a successful operation, Ken is ready to be discharged.
Yay!
As Lucy has told him that the waiting time for his doctor's approval to discharge is about 2 hours, Ken kept a book handy, while the staff does all the work to prepare the bill, medication, and documentation. After making his payment during discharge, Ken goes home and looks forward to a full recovery.